Hi again, Dr. John with Pro Chiropractic, and today we're going to demonstrate some more adjustments. And specifically, we had a request about adjustments of the shoulder and collarbone and ribs when you have pain in the front. So there's some testing and adjustments that we do to address joint dysfunction in these areas. Michelle had volunteered here, and we're going to demonstrate some of those. So we ran through an analysis before we were shooting this video, and we found some dysfunction on the left side here. So we're going to show how we can find that, assess that, and treat that. So the first thing we do is isolated muscle testing. So with this, we're going to have her hold her arm out, locking her elbow, stabilize on this side. I'm going to pull down and out, and I want you to hold against me. Okay? And she holds pretty firmly here. That's the pectoralis muscle and the clavicular portion. So we're addressing the SC joint, or where the collarbone joins the sternum here. So that one looks good. And now I'm going to push out in this direction. I want you to resist against me. And with this one, she just doesn't do it quite as good as she did on the other side. And hold. Okay? And so this one addresses the anterior ribs, so where the ribs join in the front. And then last of all, we're going to have her bend her arm like this, hold against me, and don't let me press down. And this gives away pretty easy. I'm actually going to come to this side just for the purposes of demonstration and show, hold against me, and don't let me push down. Okay, I'm pushing quite a bit harder than I was on the other side, and she's able to resist that quite nicely. So that tests and isolates the brachioradialis muscle that crosses the AC joint. So what we found is dysfunction at the AC joint and at the ribs as they join to the sternum in the front. So the way we would address or adjust those is we could bring her arm out like this. Go ahead and bend your elbow. Good. We'd get on this side of the collarbone as it joins the shoulder blade, and the adjustment would be in like this. Okay? If we were addressing the collarbone, which we didn't find dysfunction in on the other side, it would look something like this, holding the other edge, and distract, and thrust down just like that. And then lastly, the anterior ribs can be adjusted by finding where they join and putting pressure across, or sometimes this is more comfortable, using an instrument. So we would find the dysfunction in the rib, and we would use the instrument to move those in the right position. This is an IQ adjusting instrument, and we shot a video about this specific instrument if you'd like to click and look at that as well. So what we reviewed is joint dysfunction at the collarbone, at the AC joint, and at the anterior ribs. All areas that chiropractic care can make a difference with. If you have any questions, be sure to post them. We will respond to them, and thanks for watching us. Have a great day.